My name is Dr. David Vine. I'm a dentist on Miami Beach. I've been in practice for 46 years. Today I'm going to talk with you about how to avoid dental implants. When I went to dental school at the University of Maryland in 1972, we were taught very conservative dental techniques. In other words, we were taught how to save a natural dentition via prevention. When a cavity forms, how to remove the decay and fill it conservatively. When you have gum disease, how to treat it before it causes loose teeth. What I'm seeing today is a proliferation of dental implants as a result of patients' full mouth deterioration. And patients are getting tired and disgusted and saying, well, just pull all my teeth out and put implants in. Well, that's one way to go. However, I find it's better to try to save a natural dentition. And the way we do that is through conservative cavity preparation, removing tartar and plaque before you get gum disease. Implants are very good when used in a situation where you cannot salvage a natural tooth, but even implants fail. So in order to avoid implant therapy, what does a patient do? A patient needs to have preventive therapy, and that means a complete examination by a dentist that knows what they're doing and is straightforward with the patient. If you have a cavity, remove the decay and fill it. If you have gum disease, remove the plaque. It's when you avoid these therapies that the situation deteriorates and becomes more time-consuming and more expensive. Well, let's say you have a molar that has deep decay and you haven't gone to the dentist in 20 years. And now you go to the dentist and they say, well, we can't save the tooth, we have to extract it. So they extract the tooth. Now, do you need to put an implant in? Do you even need to replace that tooth? Well, there are a lot of circumstances and situations that you don't necessarily have to replace a tooth, and you don't necessarily have to place an implant. Suppose this molar is surrounded by two adjacent teeth with large cavities. Then why not put a bridge in? Why not prepare these teeth and put a false tooth in the middle? That's a way to avoid implant therapy and avoid surgery. So basically it boils down to having a complete examination. If you're told that you need implants, maybe get a second opinion. So I wrote this book, Understanding First Class Dental Care, about 18 years ago. And I wrote it, it's subtitled A Human Interest Story. And by that, I wanted to show pictures of how I grew up. And when I read a book, I like to know a little bit about the author and why would someone become a dentist to begin with, and what is the dental education, and how did they experience childhood. In this book, I wrote it with the intent of educating not only patients, but dentists, young dentists, or dentists who have been in practice for a while, in terms of what I learned regarding proper therapy. And the book describes with photos what a small cavity looks like, how we treat it, what happens when a small cavity becomes a big cavity, when a crown is necessary, when nerve damage occurs, when you need a root canal. And I also discuss the controversies in dentistry.